Hello again, everyone. My name is Marty Guthmiller, and I am CEO of Orange City Area Health System, bringing you today on October 9th, 2020, the 62nd edition of our COVID-19 community briefing. As it is the end of the week briefing, I will not have a local scoreboard today, but I will provide probably a little bit more in-depth local snapshot of where we are as of this morning. So I will provide that once I go through the statistics. Sioux County this morning, per the coronavirus.iowa.gov site, has 2,000 positives, and even 2,000 of the 8,543 tested. That is a 23.4% positivity rate and is 109 more positives since Monday of this week. The 23.4% positivity rate compares historically to 22.7 in our previous briefing, compared to 22.3 prior to that, compared to 21.6. So again, laddering up, we're at 21.6, 22.3, 22.7, and today 23.4. On the 14-day average, which is a number we've been increasingly paying attention to over the last several weeks, Sioux County is now number 3 in the state, and that's a positive move downward at 23.4%. The 23.4% is our lowest number over the last several weeks, and I'll give you that hierarchy as well. Prior to this briefing, we were at 27.0, then we were at 27.7, 29.6, and 31.2. So we've decreased for 5 consecutive briefings now, which would be a period over about 2.5 weeks. So that number, while it's still over 20%, it is down and is consistently dropping from the 31.2 that we were at previously. Lyon County remains number 1 in the state at 27.4. That number is down though as well, although still high. Previously we were at 28.8. and 30.8 prior to that, but Lyon County does remain at number 1. O'Brien County was number 5. They now dropped to 14th, so a significant drop there, 15.9% in O'Brien County. They were at 19.2. Plymouth County remains at number 10, and actually the rate has gone up a little bit there. Plymouth County is at 17.7. and they were previously at 16.2. So, it's too early to predict any kind of trends or celebrate anything, certainly, but we are moving in the right direction, and hopefully we'll continue to see that 14-day drop. The other number that I've been reporting on is the number of counties at 10% or higher. That number is up. 43 counties this morning at 10% or higher. That number previously was 37. However, while the gross number is up 10% or more, there are much more counties in the lower portion of that. So 10 to 12%, a higher percentage are in that category. And so that is a positive number, even though the gross number of counties in the 10% and above are up. Region 3, as has been consistently reported here, is the next set of statistics we look at. Region 3 hospitalizations, up substantially. That number is 126 as of this morning. That number previously when we had talked was 89, so it's up substantially, 37. And the time before that was 97. So we've got 97, 89, and now today 126. And again, Region 3 is in the 20 counties in Northwest Iowa. The ICU in Region 3 has 21 patients. Those numbers prior to, in our prior briefings, were 18 and 18, respectively. We've had 15 patients admitted in the 20 counties over the last 24 hours. 7 of those 126 patients are on ventilators. The ventilator capacity in our area is vast. It's wide open at this point. And we have nearly 400 beds available in Region 3. Now, not so much in Woodbury County, but Region 3 as a northwest tier of Iowa, so there is plenty of bed availability in those 20 counties. Iowa, 96,980 positives. My guess is when we speak on Monday, that will be over 100,000. We'll see. So 96,980 of the 848,700 tested. That is 11.4% positivity rating. This statistic is climbing incrementally. The last 5 times, and I'll start with the oldest, 11.0, 11.1, 11.2, 11.3, and today 11.4. So it is climbing also gradually, but nonetheless climbing. Another statistic that we've talked about periodically that I think is good to look at is the positivity rate per 100,000 population. BV County, Buena Vista County, is by far number 1 in the state at 10,617 positive per 100,000 population. Comparatively, Plymouth County is at 5,320, so about half. Sioux County is at 5,735. So 5,000 out of 100,000 is still a pretty high number, but that kind of puts things in perspective a little bit. Woodbury County, as an example, is at 6,058 per 100,000. So that's just another way to look at the positivity rate when you extrapolate it over 100,000 population base. Hospitalizations in Iowa. Now I looked at the coronavirus.iowa.gov website this morning, and the hospitalization rates were listed as of October 7. So it is a little bit dated, and you always have to check that timestamp. The hospitalizations today were at 418. That is up from 364. I'm a little distracted right now. The helicopter's coming in, as you can probably hear. So hospitalizations in Iowa, 418. Previously, we're at 364. The time before that at 315, and the time before that at 276. So there's no question the trajectory is climbing, and there are a lot of patients hospitalized. Sioux County is now number 5 in the state in terms of hospitalizations, with 22. And again, that would be Sioux County residents hospitalized somewhere at 22 today. Plymouth County, as an example, is at 8 today. O'Brien County 7, Lyon County 0. Woodbury County is number 1 in the state at 42. And Polk County is number 2 in the state at 36. Again, remember that in Woodbury County's case, as an example, there are 42 Woodbury County residents hospitalized somewhere, most likely in Sioux City, but somewhere. That does not represent all of the patients hospitalized with COVID in Sioux City, however. As of yesterday, which is a little more current data, I know that there were 73 COVID patients in the 2 Sioux City hospitals as of yesterday. I do receive that census information, and I know specifically that there were 73 patients yesterday. So 42 Woodbury County residents as of Wednesday. But as of yesterday, Sioux City has 70 in the low 70s for number of COVID patients. Deaths continue to climb in our state as well. We've had 45 additional deaths since we spoke on Monday. The number is 1,433. Sioux County is now officially at 7. We have a number of seniors I know in our county that are positive. The majority of them are doing very well. But I think it's unreasonable to expect all of them to do well. And they are our most vulnerable population, and that is where most of the concern lies at this point. But officially we're at 7 currently, and we certainly hope it stays at that number. I'm going to transfer a little bit now over to what's going on here this morning at Orange City Area Health System. In addition to the helicopter that just flew in, that I believe, my understanding, is a COVID transfer to Sioux Falls. We have 9 inpatients currently here in the health system. We are expecting to discharge 2 today. Our emergency room at the moment, this morning, is relatively quiet. So that's all good news. In terms of our capability to house COVID patients, we do have 11 negative pressure rooms, which again is an extra measure of safety that we have for controlling airflow in and out of rooms. In this case, it would be all out with negative pressure. Whenever you open a door, airflow always goes out through a HEPA filter and rather than back into the hallway. So we do have 11 rooms with that capability currently, and 2 of those rooms have the capability to have 2 beds. And so we actually, on a max COVID basis, we'd have the capability of 13 beds in 11 different rooms. As evidenced by the helicopter flying in just a few minutes ago, critical transfers are still available, whether that's to Sioux Falls, as this case was, or to Sioux City. Those transfers are available. However, we are being asked increasingly to keep patients here when it's safe to do so. And our use of therapeutics, convalescent plasma, and remdesivir as an example, and other treatments are readily being done and readily available at this point. And so we're comfortable in the position we are. You should be comfortable in the position we are. And when needed, we can get you the extra care that you need. But in the meantime, we're providing a significant amount of that care close to home and by people you know and trust. And so we're doing that. And we have no issues right now with convalescent plasma access. Remdesivir supplies are fine. PPE is fine. And so our folks are doing extremely well, and they're hanging in there and being heroes in providing the care that you need. So we're grateful for that. Some news at Landsmere Ridge. As of yesterday, we did close Landsmere Ridge to visitors due to the fact that we had positive staff members and some positive residents. And so we felt in the best safety of everyone that we closed Landsmere to visitors. Residents are being asked to stay in their apartments. We deliver food to them. We shop for them. We provide all their supplies. They can come and go on kind of an emergency basis if they need to, doctor's appointments and things like that. So they are not locked into their apartments by any means, but we are asking no visitors and to wear masks when they're inside the building and to limit their movement for sure in the building. Window visits are available. And so that does continue. Prairie Ridge, haven't had a lot of change there. Window visits are still there. We continue to test staff twice a week there at Prairie Ridge, and we test all residents weekly at Prairie Ridge, trying to make sure that if we do identify a positive, particularly in a resident, that we can isolate that extremely quickly. We've been very fortunate that we've not had additional positives at Prairie Ridge for probably, I don't know, 6 to 8 weeks or so at this point. So continue to do that. An awful lot of testing going on at Prairie Ridge, and again, trying to protect the most vulnerable folks that we have. Just on the hospital front, rapid testing is becoming much more available. Our supplies are increasing in our availability to do that. And so it's still on a need basis, but that availability is increasing, and I think it's good for you to know that. When those testing avenues are not available, please remember the Test Iowa Clinic is Monday through Friday morning, 7 a.m. to 9 a.m. Go to testiowa.com. You'll get a QR code downloaded to your phone, and then show up at our occupational health clinic between that 7 and 9 a.m. window, and you will be sure to get a test at that point. We encourage you to receive your flu shots. It's going to be really, really important as we go through the fall and winter months that we protect everyone as much as we can from flu. And remember that flu is a deadly virus as well, and we ask you to protect yourself from that. We also ask you to continue to mask, to continue to socially distance, and to continue to practice good hygiene. We will get through this. And if you try to focus on controlling what you can control, that's what we're asking. This disease is very real. The deaths are very real. The images on our radiology reports are very real. Yet we are extremely grateful that the vast majority of folks are not becoming seriously ill. People are getting sick for sure. Some are requiring hospitalization. But again, it's a very small subset of those folks even that receive hospitalization that require transfer out. Most of the folks by far are not requiring advanced treatment. Those that require advanced treatment are doing well, and those that are requiring critical treatment are getting that as well. So, but again, each time we step from one level to the next, remember that that is a very small number. Not that it's inconsequential, not that it's not real, because it is. Not that it doesn't have impact on healthcare workers and staffing and society as a whole. But we do have to keep that in perspective, to control what we can control. And we will get through this. There's no question that we will. And sometimes we have to remind each other that we will get through this. But by controlling what we can control, by using common sense, by practicing good common sense measures, hygiene and the like, by something as simple as wearing a mask, please do that. If we can do that for the next week to 2 weeks, you're going to see some dramatic changes. We just need to get through this, and we will. There is light at the end of the tunnel. So with that, enjoy your weekend. I remind you to stay strong through all of this. And as we just talked about, stay vigilant. And above all else, of course, stay healthy. Thank you again for the trust and confidence placed in Orange City Area Health System. It's an honor and privilege to take care of all of you. And we're very grateful for each and every one of you. Thank you for joining us. We will look forward to a briefing on Monday, again, to be able to give you some local statistics and information. Thanks again. Have a great weekend.